Hello, in this video I'm going to perform extra and intra examination on patient. So before proceeding to the procedure, I need to wear the PPE to prevent transmission of infectious disease from patient to patient, clixons to patient, and patient to clixons, and also avoid exposure to any pathogenic bacteria. So I will start first with hand sanitizing. Put a few drops of hand sanitizer to my palm to palm with interlaced finger, back of the finger, rotate around the palm, rotational rubbing of the thumb, rotational rubbing of fingers of one hand to the palm, other hand, vice versa. Make sure my hand is dry completely. So because my hand is not basically soil, I'm using hand sanitizers containing 75% of alcohol with no flavor of aloe vera. So when my hand is basically soil, I need to wash my hand with soap and water. So it's really depend on procedure treatment that I'm going to do. So the next step I will before stepping to clinical treatment. So normally I will wear level 1, level 2 surgical mask. I can wear a mask outside the campus, especially during COVID time. It's important to put mask on all the time. But when I step into the clinic, I need to change the surgical mask, the whole mask, into clinical mask, which is sterilized and placed in a green box. So find a box that labeled with my name and change the whole mask into clinical mask. Open the mask, put the mask on that cover the nose, the mouth, and the chin. Pull the string over to the back of the head and the bottom string over to the back of the neck. Okay, mold the metal strip to feed the bridge of the nose and check feed of the mask. Make sure there's no air escape. Breathe out, breathe out. Okay, so I see there's no air escape and my mask is inflating, which is a signal for me to see that my mask fit into my face. Okay, next I will put on the gown. Okay, check if there's no hole, no crack. The gown is in integrity condition. So there's two tie at the back, tie one on the neck, and tie one at the bottom. Make sure it's fully covered the strap. Okay, next I will put on the clinical cap. Currently I don't have clinical cap on hand, so when I'm at clinic, make sure put on the cap, fully cover my hair, and put the cap underneath the strap of the mask. Next one, I will put on the eyewear, fully cover my eye. Put on the face shield, so the face shield is placed in the middle of the forehead, the string on the back. Sanitize my hand again. Make sure the hand is completely dry, so it's unnoticed that my hand is safe. And then I'll put on the glove. Make sure it's cover the top of the gown. And after that, check if everything is on and I'm ready to get into the clinic. Okay, so now I will perform an extra intra-oral examination on myself. So I will imagine myself as a patient that I will meet in the future. The procedure is presented in the following detail. So before I start the exam and enter the patient care treatment area, I need to make sure I have PPE on, which is the gown on, cover the inside, cover the strap, mask on, eyewear on. Make sure the cap, when I enter the clinic area, the cap is also covered completely my hair, and also gloves on. Oh, okay, I will hand sanitize my hand. Make sure it's completely dry and then wear a cup. Make sure the cup is cover the cup of the gown. Now I have glove on because I'm doing the extra-oral examination on myself. So I will take off the protective eyewear and the mask. Okay, so before I start an extra-oral examination, I need to inform the patient about the procedure. So I will say something like, I'm going to perform an and extra-oral examination by looking closely into your face, your head, your neck area, and into your mouth to see if there's anything abnormal. So do you feel comfortable with it? Or have you ever had any lesion in the past? As I'm doing this, so I just let me know if there's anything tender or painful. Okay, after informing the patient about the procedure, I will place the patient in the supine position, illuminate all the structure with operatory light. So as a dental hygienist, I also need to practice ergonomic posture. So I will first start the extraoral examination by observe the patient's face. So I will look for any abnormality, skin color, skin texture, any lesion, any sign or symptoms of skin cancers like basal cell carcinoma. So if patient has a red or pink waxy raised ulcer with irregular blood vessel, if the patient has this sign, I will ask the patient how long has it been and does it hurt the patient. So I see that the patient face look normal. There's nothing special, nothing look out of normal range, except for there's some acne or pimple around the chin. So I will ask patient how long has it been and does it make patients feel uncomfortable or feel painful. Okay, next I will observe and examine the head and neck area, specifically the lymph node. So I will observe and palpate the suboccipital, which is located on the back of the neck. Observe and palpate the retroauricular observe the lymph node. Okay, feel if there's any enlarged lymph nodes. So there's nothing feel abnormal. Next I will observe and palpate the TMJ by palpate. Next step I will observe and palpate the TMJ. So instruct the patient to open and close the mouth. Feel any deviation. Also instruct the patient to bring out the jaw and move the jaw side to side. Here, if there's any click or abnormality, so if there's a click occur in patient, then I will ask the patient, does it hurt the patient? If I hear the click without hurting the patient, then I will record a symptomatic click. Okay, next I will observe and palpate the submandibular. So submandibular nodes are superficial to submandibular plane. So I will palpate laterally, bimanually, and circular. Then I will observe and palpate the submental nodes, which are easily found by tipping the head forward, roll the nose along the lower borders of the mandibular anteriorly. Okay, next I will observe and palpate the cervical lymph nodes by asking the patient turn away from the areas that I'm checking. So when the patient turn away from the operator, the sternocleidomastoid muscle are pushed out, and when I palpate my finger along the neck, the cervical lymph nodes is more obvious. I will do the same technique on the other side. So when observe the lymph node, observe if there's any enlargement. So if there's enlarged node being recorded, so I will pay attention to consistency, tenderness, mobility, number of enlarged lymph nodes, and erythema around the affected area. Okay, after I finish the extraoral examination, I will remove glove. Toward away in a dustbin where it is designed to go, and then sanitize my hand with alcohol paste hand rub. Make sure my hand is completely dry. So I notice now it is safe, and then I don the new gloves. Now I will move on to intraoral examination by start to observe the lip first. So in the lip structure, I can see some related structure like vermilion border, philtrum, labial committer. When the patients open and close the lip, observe for any cancer, lesion, abnormality. The lip look appear to be normal. Next, I will move on to observe visually the entire oral cavity, the oropharynx, radial part, and maxillary tuberculosis. So radial part is located posteriorly mandibular jaw behind the molar. The same the maxillary tuberculosis posteriorly maxillary jaw and posterior to the molar. Okay, I will use the index finger placed intraorally and thumbs placed extraorally to retract the lip. retract the lower lip. Observe if there's any abnormality. I can see the labial frenum. Okay, on the upper lip, I can see the labial frenum, alveolar mucosa. Next step, I will use the index finger placed intraorally and thumb finger placed extraorally to retract the cheek. I'm using the mirror. I'm using the mouth mirror to see the structure inside the buccal mucosa, like linear albia, parodic papilla, and Stenson duct. Also use the mouth mirror to see the retropart and maxillary tuberculosis. Use the tip applicator to point out the structure. Okay, I will also use the index finger intraorally and thumb finger extraorally to observe the same structure on the other side of the cheek. Okay, next I will palpate the labial mucosa and buccal mucosa to see if there's any lesion, abnormality, enlargement, ulcer. Okay, for the labial mucosa, I'm using index finger placed intraorally and thumb finger placed extraorally to palpate bidigitally. For the buccal mucosa, I'm using the index finger placed intraorally and ring finger of the other hand placed outside. Okay, I will do the same technique for the right cheek. So I will pay the buccal mucosa by manually see if there's any anything special or noticeable. Okay, next I will move on to examination of the floor of the mouth. So I will instruct the patient to chin down, open the mouth wide, and stick the tongue to the roof. I'm using the mirror to see the structure of the floor of the mouth and visibly examine the floor of the mouth if there's any thing out of normal range. I can see lingual vein, lingual frenum, fimbriated fold, Warren duct, sublingual, caruncle, and sublingual folds. These are all structures that I can find in the floor of the mouth. So if there's any thing that out of normal range, that visibly abnormal, and I can palpate the floor of the mouth by manually using index finger placed downward in the floor of the mouth, and ring and middle finger of the other hand placed under the chin and press upward. Okay, next I will move on to examination of tree surface of the tongue. So I will observe the dorsal of the tongue, ask the patient to stick out their tongue, and I here can find some related structure to the surface of the tongue, such as filiform papilla, which are located on the tip of the tongue, the whiting, fungiform papilla, mushroom shape, and circumvallate papilla, which is located very innermost, and foliated papilla, which is located laterally to the tongue. So I will use the gauge to explore the size of the tongue. So I'll use the gauge, wrap the tip of the tongue, and gently pull it out, pull it to the side to visibly examine the lateral posterior side of the tongue. Here's the gauge, wrap around the tip of the tongue, pull it out to the side to see the posterior side of the tongue. Okay, so I will use the mouth mirror to see the lateral size of the tongue, the indirect visual, and palpate the tongue bidigitally. So after observe the floor of the mouth and the tongue, now I will move on to examination of the hard palate and oropharynx. So I will ask patient to chin up and open the mouth wide. Use the mouth mirror for indirect vision and illumination. Observe the hard palate and related structure like incisive papilla and palatine rugae. Okay, so next is observe the oropharynx. So I'm using the mouth mirror, gently press the tongue down and outward and have patient say R to observe the structures such as uvula, soft palate, volatile tonsil, and then I will palpate the hard palate digitally using the index finger. The oropharynx cannot be palpated. The last structure is alveolar ridge, which located near the alveolar mucosa. I'll palpate the alveolar ridge using bimandibular palpation. So the procedures will be done like so. And this is the procedure of how to perform extra and intraoral examination. So during the extra and intraoral examination, I will recognize the abnormal finding, including trauma, swelling, lesion, lump, area of hardness, tenderness, inability to express saliva. I will also document abnormalities on my patient chart, including anatomical location, anatomical position, color, border, consistency, configuration, diameter, type, and texture, including the history and any descriptive term. I'll transfer all the finding during extra intraoral examination to the record, and if there's anything suspicious, I'll ask the patient to come back after 14 days, and if they come back after 14 days and I'm still seeing the affected area, then I will refer the patients to physicians for treatment.